Hello friends, in this video we'll talk about hip joint. So first we'll talk about type and articular surface, capsule, synovial membrane, ligaments, relations, movements and muscles, blood and nerve supply, bursae and the applied aspect. So first type and articular surfaces. So this will be the articular surfaces. First let us see that. It will be the head of the femur. Yes, head of the femur and the acetabulum of the hip bone. So acetabulum of the hip bone and the head of the femur articulate to form the hip joint. Okay. And coming to the type, this is possibly the hinge variety of the synovial joint. Okay. Right. Let us move on to capsule. So you can see the attachment of the capsule. It will be in the intertrochanteric line over here. Capsule attaches here, intertrochanteric line. You are seeing that. Okay, that's the location of the capsule. Let us see the synovial membrane. So how the synovial membrane is? So it will start from the head of the femur, goes like this. Then from there is a transverse acetabular ligament, then zona orbicularis through the intertrochanteric line. It will attach above the acetabular fossa, like a U shape it will go. Okay, that is synovial membrane. Now the ligaments. So what ligaments are there? We have ilio, ischio and pubofemoral ligaments. Here you are seeing the pubofemoral ligament. Yes, and here you are finding the iliofemoral ligament. It has a lateral and a medial band. Together that is called iliofemoral ligament. From the ilium to the intertrochanteric line of femur. Pubofemoral is from the pubic crest up to the intertrochanteric line of the femur. And this is a thin portion. Okay. And this is the site for the bursa. Now let us see the ischiofemoral ligament. So from the ischium into the greater trochanter of the femur. This is greater trochanter. Okay. Don't think it's lesser trochanter. Okay. This is a Y shape. Sorry, this is a straight ischiofemoral ligament. Okay. Let us see with the relations of the hip joint. So what you are finding? Superior, posterior, inferior and anterior relations. Okay. Now let us see superior relations. The three gluteal muscles, maximus, medius, minimus, along with rectus femoris, two heads will be there, reflected and straight. Reflected one in the superior, straight one in the anterior. Okay, straight, A for anterior, remember. So let us come to the anterior. Okay, so you are also seeing the iliopsoas muscle. Okay, this is the bursa, synovial bursa, and this is the capsule, the joint capsule we are seeing. And then the van structures of femur, femoral vein, artery and nerve. From the femoral artery, there is a branch medial circumflex femoral, that is in the inferior, along with obturator externus and pectineus muscle. Posterior, if we see, we have the piriformis, sciatic nerve, the gemelli with the obturator internus, quadratus femoris and the nerve supply too. Okay. And also some part of the gluteus maximus will be there. Let's see the movements and the muscles involved. So what are the movements of the hip joint? Flexion, extension. So first of all, circumduction and then medial and lateral rotation. In the circumduction, first is the flexion. Okay, so I'll tell you how to remember this table. Okay, so right. So here we are seeing where you are finding the sartorius. So sartorius is mainly going to do the flexion. So psoas major and iliacus primary, secondary will be the sartorius, rectus femoris and the pectineus. Extension is by the gluteus maximus and the hamstrings. Three gluteal muscles are there. Maximus will do extension. Medius and minimus will do abduction. Okay. And tensor fasciae latae will be there. And remember now, sartorius will do flexion and abduction. Two movements will be there. Okay. And rectus femoris, pectineus, one movement only. Then adduction. Please remember, adduction is done by adductor muscles only. That is the longus, magnus and brevis. Okay. Secondary will be the pectineus. So pectineus is doing flexion and adduction. Okay. And gracilis also over here. Medial rotation, same what was for abduction will be the medial rotation. Only sartorius will not be there. The only difference is there is no sartorius in medial rotation. So if you know abduction as it is medial rotation, difference I told you, no sartorius in medial rotation. That's all. And lateral rotation. This is done by piriformis, obturators, gemelli and the quadratus femoris. Okay. Next, coming to the blood and nerve supply. Already we have seen the medial and lateral circumflex femoral. Even gluteal will be there, superior inferior gluteal and obturator if present. But mainly remember these two, medial and lateral circumflex and the gluteal arteries. And nerve supply, femoral, quadratus femoris. Please remember these two mainly. Obturator will be common for both. Okay. Let's see the applied aspect now. First, the types of fracture of the neck of the femur. Please understand that there are four kinds of fracture in the femoral neck. We have the subcapital, cervical, basal and petrochantric. Please remember these four names. I'll repeat once again. Subcapital, cervical, basal and petrochantric. Okay. Now dislocation of the hip joint, it can be congenital or acquired. Very common to happen during congenital stage because that time the joint capsule is very loose. For a just born baby, the joint capsule is very loose. So there will be higher chance for dislocation. It can be a defect in the acetabulum development. Maybe at that stage the acetabulum was not properly formed. That could also be a reason. And acquired automobile accidents. Remember, more the joint mobility, more the tendency for accidents. Like take shoulder joint, more tendency for dislocation. Hip joint, very less because the head of the femur completely fits into the acetabulum. So less tendency for dislocation, especially during automobile accidents. For example, take an instance where there are two cars on the road coming on the same lane. So when both the cars are crashing, what happens? The head of the person will touch the steering wheel, and what will happen is the hip joint will move forward and suddenly the head of the femur will dislocate from the acetabular fossa and also the ligaments will be torn off. This is in the case of automobile accidents. So that is it about the hip joint. So references from where I took the images. That brings us to end of the video. So thank you so much. I'll see you in the next video.